You know, everyone's looking for a great, easy way to lose weight, maybe do some reshaping of the body. Well, you come here and talk to Dr. Donald Balder at the Institute of Weight Loss Surgery in Gulfport. How are you, sir? It's good to see you again. It's been a while.
It's been a long time, yes, sir.
Yes, it has. First off, tell us a little bit of background about yourself for those who haven't seen you in a while.
Well, I moved here to the Gulf Coast over 10 years ago, doing mostly weight loss surgery, and really had so many patients wanting to get back into the aesthetics part of things, and so we're doing all of the facial aesthetics, of course, body aesthetics, fat transfer. So wanted to talk a lot about that today.
Well, we're going to talk about this thing that you do is called Beauty Fill.
Yes, sir.
And I mean, matter of fact, you can go on his website, which is on your screen there, and find out a lot of information about it in case we just kind of scratched the surface here during this time. But tell us about Beauty Fill. What is it?
So Beauty Fill is a unique small cannula liposuction device that we can utilize on patients that are awake using a compound called tumescence to anesthetize the area we're working on. And we can do regular liposuction and take the fat out, or we can even take the fat out and move it to another part of the body. One of the common things a lot of my patients were doing would go into Atlanta or Miami for a BBL, and we can offer them that procedure right here under the safety of local anesthetic in Gulfport, Mississippi.
BBL stands for?
Brazilian butt lift.
Brazilian, well, I started saying big butt lift, but
There
Brazilian
you go.
butt.
So we can take fat out of the belly, the sides, the back, lipo 360. We can move it to the bottom. We can move it to the breast. We can move it to the face, lips, hands. Fat is full of stem cells. So any place we put them, it rejuvenates the skin underneath them. But also, as long as it's attaching to another fat cell, it's going to survive. Beautiful has a unique suction filtration system where they boast that the fat transfer is about 90% successful, which is well above normal fat transfer. The uniqueness of their laser is set at the wavelength of water. So when it bursts the fat cells are all viable. So the sucking out of the fat cells maintains their viability and allows us to transfer the fat if the patient wants that. And most of our patients have decided they really do want that.
So if you have belly fat, you can get that and transfer that to your butt
To
or
your
anywhere.
bottom, to your breasts. A lot of our face droops the main reason our face droops, people don't understand this, but the main reason our face droops as we get older is we lose our fat pads. So we can retransfer to the fat pad and allow it to pull up. Everybody gets the radiesse, the different types of fillers that last a short while. Well, they lift the face back up, but we can put the fat pad back in place with fat transfer.
Without having to do what the facelift kind of thing?
Without having to do facelifts, we do offer PDO threads and other, again, local lifting devices. But yeah, we can probably, either avoid the facelift or, drastically push it downhill for years to come.
What are the benefits? I mean, it's going to last a while, a lot longer than, well, you mentioned you can put some like in the face, the forehead. A lot of people will do Botox.
Sure.
But Botox doesn't last that long.
So Botox, takes away the moving lines, doesn't do anything for the static rhyatids, but it does have some also effect of changing your face so you're not going to develop those lines, right? So Botox is a secondary effect, and we of course educate our patients about those effects as well.
That's why you see so many scary pictures of celebrities and things like that have that look on their face that they can't really move anymore.
Yeah, some people overdo it, but you can do a little bit less and make it so you have mild movement, Yes, sir.
Who is a good candidate for laser lipo? I mean, this is not like regular lipo where where you do put them under. This is you don't put them under for this.
So, a consultation is what's mandated, right? We see the patient, we see what their body image is, we go over expectations. A body mass index 30 or less is going to do much better than a body mass index higher than that as far as laser lipo. So we, if people need help with a diet to get their BMI down, we can help them do the pre-op as well. But somebody who's unhappy with their body shape and wants some changes is an ideal candidate for our helping them.
I was looking at this poster that you have back here, Dr. Balder, about, I mean, the difference, of course, she's tan in one and she's not in the other. But I mean, you can really see the difference. I mean, the rear is nicely shaped here afterwards. Stomach is gone, so I don't know if they transferred it from there to there.
So this is a lipo 360 with BBL transferred to the bottom, giving that rounder Brazilian butt lift appearance. And before and afters of a face with some fat transfer to the face to lift it a little bit. You see
Yeah,
the
because you
lifting
can see
effect.
the pockets down underneath here, whereas it's a lot more smoother than there.
Correct.
And again, as you said, it's going to last a lot longer than the Botox does.
Oh, if the fat cells remain viable and attached to other fat cells in the area, it's going to maintain forever. I mean, we're putting fat cells that are full of stem cells for viability.
Because with Botox, you're basically putting something foreign in your body, whereas this is, hey,
Botox is blocking the muscular change, so
Right.
we're blocking the motor end unit of the muscle in your face or wherever we're going to put it, and this is going to instill volume where we want to instill volume and give the patient their necessary effect.
now what can someone expect? If they come in here, they do a consultation with you with the Beauty Fill treatment. How long does it take? I mean, do they knock them out or what?
Yeah, so the consultations have a nominal fee. The fee goes towards your procedure. We have the best prices for this sort of thing anywhere on the coast. But we want to go over what the patient's expectations are. You know, are they going to need more than one procedure? Because we are using local block, so there's a limit to the amount of lidocaine we can use. So if somebody wants their legs, their arms, their belly all at once, we're not going to be able to do that because of the amount of lidocaine we have to use.
Right.
So we'll go over expectations. We have several patients that want to break it down into 2 procedures, and that's fine too.
So you just this is the table that you do the procedure
This is the
on.
OR bed. We lay them down. We actually prep them in the room before by marking the areas that we're going to take out and marking the areas we're going to move fat transfer to, should we be doing that. We lay them down, we numb them up, prep them, numb them up, and use this wonderful device for laser lipo. Open up the liposuction kit. It's got all the things we need, and get going.
This is also a the fat transfer?
The fat will come into a sterile unit here, and we'll be able to take that and pull it onto a syringe sterilely and get it ready on the back table for whatever place we're going to inject it to. So again, the benefit of the local anesthetic, people can get up in the middle of the procedure. We can walk them to the bathroom if they have to use the bathroom. We can walk back and re-prep them and get back at it again. So it's a very nice, people sometimes listen to headphones. They'll talk with us during the procedure, but it's not a painful procedure to be done under local anesthetic. And because of that, you're not going through the risk of putting to sleep. We're not doing large bore cannulas that cause bleeding.
No drain tubes or anything like that.
No drainage tubes or anything like that.
That's awesome. Dr. Balder, thank you so much. I'd have to come back and talk to you sometime soon. If you'd like some more information, again, go to the website. The website is on your screen, and find out if you're a viable candidate. Call them up, make an appointment with them. They're located out here on close to the hospital in Gulfport.
Yeah, David Street.
David Street. I started to say Harold Street, David Street. But they're on David Street. Set up an appointment and come make a change in your life.